All right, everyone. Hey, this is Dr. Alan Hopkins. I am super excited to come today from Austin, Texas, where we're going to talk to you about ways to use advanced biomarker tests to optimize our ability to heal. First of all, a little bit of background on myself, just so that you guys know. I am a medical doctor. I did get a degree at Loma Linda University Medical Center. And the really cool thing about training there is that a person was not a disease. A person was actually a person. So here, let me give you an example. So it wasn't John in the back with colon cancer. It was John. He happened to be married, and he had 4 kids, and he worked as a machinist, and he happened to have the unfortunate diagnosis of colon cancer. And they really taught us to approach people in a very well-rounded way. And I love that about Loma Linda training there. It was very much a very comprehensive approach to patient care. I became an emergency medicine doctor there. I became board certified. Following about 20 years of practice, I went into anti-aging medicine, and I got a fellowship through the American Academy of Anti-Aging and Regenerative Medicine. And I got hired as a consultant for some advanced biomarker companies. We did shows like NBC's Biggest Loser and the Oprah Winfrey Show and so on. And then most recently, in the last couple of years, I founded my own direct-to-consumer lab testing site called yourlabwork.com. And I'm doing this while working as an assistant professor at the Dell Medical School here at the University of Texas, where I get the opportunity to teach young doctors and residents and medical students and so on. So the objectives for today, and I really appreciate everyone joining us, is we're going to really talk about what wellness labs can teach us about optimizing our health. We're also going to talk about, why aren't they being done in a traditional medical environment? And then also we want to learn, and this is super important, why normal ranges, or the so-called reference range, really is not what we should be looking at for optimal health. We want to be looking at optimal ranges. And then, of course, we're going to talk about how you, just sitting out there right now, if you have access to a computer and you live here in the United States, you can get access to some of these same tests today without first having to go to your doctor. So it really empowers people to take their own health into their own hands. So I want to start with a concept first, and I want to talk about the 5 pillars of aging well. And there are 5 pillars, inflammation, metabolism, nutrients, hormones, and cholesterol. And every person that I see, I try to approach them in a very comprehensive way. And so we have to think about these critical areas of the body. So I want to just take a few minutes and dive into each one of them, just so that you guys get a little bit of a background. So the first thing we think about in the aging process is inflammation. And we do know that inflammation is very dangerous for our body. In fact, it's thought that inflammation is the root cause of all chronic disease. And we find out that more inflammation that we have in our blood, the more likelihood of developing autoimmune diseases and even cancers. So we don't like a high inflammatory environment. And there are some very key biomarkers that we can look at that will help us understand whether or not we currently have inflammation. And one of the best biomarkers for chronic inflammation is something called a high sensitivity CRP, or abbreviated HSCRP. And this biomarker has been around for a while, and we understand that if it's less than 1, it's optimal. So everyone I see, I like to make sure they're less than 1. Numbers between 2 and 10 are most likely due to metabolic disturbance. Numbers that are higher, like above 20, we really have to worry about an underlying autoimmune disease, or perhaps an underlying cancer. And we really have to dig deeper if we have these very high numbers of CRP. CRP, if the level is above 2, unfortunately, it does put us at risk for early stroke and heart attack. So one of the ways that our arteries harden is that we develop inflammation. It's the key component to damage of the arteries. And so now we have this sort of biomarker that we look at, and it's super helpful to know whether or not it's elevated or not. And if it is elevated, how high of an elevation is it? There are things very naturally that we can do to reduce inflammation. In fact, a plant-based diet is one of the best things that we can do to reduce inflammation. Eating a small amount of sugar. Now, most of us Americans are eating way too much sugar. We eat about 150 to 200 grams of processed sugar per day in this country. And the World Health Organization really recommends that we try to limit it to less than 25 grams per day. So in general, people are just eating way, way, way too much sugar, and this is putting an enormous amount of pressure on our body and can lead to inflammation. So part of the keys is reducing processed foods, limiting sugar, and moving towards a plant-based diet. Now, omega-3 fatty acids seem to be quite helpful with reducing inflammation, and you can get these in algae oil. You can also get them in flax seeds and things such as walnuts and so on. And so it's super important to know, how can we lower inflammation naturally? So again, diet and some very key nutraceuticals can really help us lower inflammation. What about these other biomarkers that are here? I want to address homocysteine. You know, homocysteine is an amino acid, and when it's high, there's a super strong association with Alzheimer's and other diseases that involve cognitive decline. In fact, a person that has a high homocysteine is very strongly associated to be 3 to 5 years behind others when we test them with processing tests. So a high homocysteine can be an indication that you're at significant risk for cognitive decline. Now, why is this? Well, it turns out we have something in our body called a methylation pathway. It's really how we change one substance in our body to another, and we do this trillions of times per second in our body. When we have a little mutation called MTHFR, we will oftentimes have trouble or struggle to do this methylation process. And this can lead to this homocysteine getting elevated in our bloodstream and an overall problem with our metabolism. So when we see high homocysteine, we like to lower it because it can be lowered very naturally for most people by giving them B vitamins. And so by giving them vitamin B12 and vitamin B9 or folate, we can oftentimes lower homocysteine. Some people require methylated folate if they have a genetic mutation of their methyl hydrofolate reductase enzyme called MTHFR. So in general, we like to look at homocysteine because if it's high, there's a strong association with cognitive decline. And we believe strongly as integrative doctors that if we treat this very naturally, decades before the onset of potential Alzheimer's, we might be able to push it out even further, or maybe the person will never develop it. What about these other biomarkers? Uric acid. I mentioned uric acid because when we get high levels of uric acid in the body, it is a pro-inflammatory state. And one of the biggest contributors to high levels of uric acid is red meat and alcohol. And so we really like to limit red meat and alcohol if a person has elevated levels of uric acid. Again, it's pro-inflammatory and we don't like to see it around in our body. Also, total CK, what is this? This is an enzyme released by muscles. And of course, we like to measure this in people, certainly if they have a lot of muscle pain and so on. But these are typically our overexercisers. People are just trying to exercise too much. They get high levels of CK in their bloodstream. All right, so the second pillar of metabolism I like to talk about is called metabolism. And really, what is this? This refers to how we're actually able to take sugar and process it in our body. And again, we have a major sugar problem here in the United States. I mentioned the average American's consuming about 150 to 200 grams per sugar. And this is actually causing enormous amounts of problems inside our body. Not only are we hardening our arteries faster, but we're creating an environment where cancer is more likely to rear its ugly head. And so we find that even if a person has prediabetes, meaning their blood sugar is high, but not quite high enough to be called diabetic, they do have an increased risk of a multitude of various types of cancers. And so even a prediabetic is at risk. And so the body does not like a high sugar environment. We can measure whether or not we're having problems by looking at our glucose, our fasting glucose, and another measurement called our hemoglobin A1C, which is the 3-month measurement of our glucose. Even prior to the glucose going high and the hemoglobin A1C going high, we may see this hormone called insulin actually elevate. So if you're someone who wants to intercept the disease in the earliest stages, we're really going to measure a fasting insulin to see if that number is high, because people develop insulin resistance first before they tend to go on to develop high levels of glucose and then the A1C. And most conventional doctors really aren't looking at insulin. And by the way, they're not really looking at CRP, and they're not really looking at homocysteine. So it can be quite frustrating to look at these biomarkers, if you expect your doctor to point them out to you. The other key biomarker that I like to look at is the thyroid measurements, because if your thyroid's not right, that can increase your blood sugar. And it can also cause problems with your cholesterol and also make you feel terrible. So we like to measure the thyroid tests, and these include thyroid stimulating hormone, and then the active form of thyroid called free T3, and then inactive thyroid called T4. And we're going to talk a little bit more about the thyroid hormones in a minute, because I'm going to give you a case study of a person who actually got her blood tests, and the reason why. So some of the best things that we can do to improve metabolism is eat a high fiber plant-based diet and drink tons of water. We're just not drinking enough water. Our bodies are 60 to 65% water. So if you're a woman, 65% of your body is water. And so it's very easy to get dehydrated. So we need to make sure we're drinking plenty of water to optimize our metabolism. In fact, I read one study where women who drank plenty of water actually had a significant increase in their metabolic rate, about a 30% improvement. So if you're out there trying to lose weight, one of the best things you can do is actually drink plenty of water. Also, we like regular exercise. Why? Because it helps that hormone insulin work better. The more muscle cells that we build, the more sensitive insulin is, meaning that it works better. And so it really gets blood sugar out of the bloodstream and directly into the cells where the cells need it to function. The other thing I want to be really careful about is if we do yo-yo dieting, or we strongly restrict our diets in terms of calories, and we really go into a starvation mode. When we do this to our bodies, it can slow down our thyroid for years. So if you're doing a very restrictive diet, you have to be careful. And if you lose a ton of weight in 30 days, you have to be concerned that not only are you going to gain the weight back, but you're also going to even put on more than when you started. And the phenomenon, the reason why this occurs, is oftentimes that thyroid gets so slowed down through that starvation diet. So the best kind of dieting is actually eliminating the highly processed foods and eliminating sugars, and then just turning more towards whole foods, because whole foods tend to keep us out of trouble, and there's still thousands of phytonutrients which are beneficial. All right, my third pillar of health is something called nutrition. And this is super key, right? It's really what our moms told us, you are what you eat. And so the way that we feed our bodies is super important. And the biomarkers here that I like to look at are, again, the B vitamins, B12 and folate, that are also involved in that methylation pathway. I like to look at vitamin D because there's very strong evidence that it can lower your risk of certain types of cancers. It can improve the function of insulin. So again, it makes insulin work better. And so we need that, right? And then also vitamin D has been shown to lower blood pressure, to reduce the amount of seizures if a person has seizures, and so on. And about 70% of us are deficient in vitamin D. So it's really important that we take vitamin D supplements for most people. Omega-3s, another really key biomarker. 90% of people are deficient in omega-3s. And omega-3s are awesome for inflammation. They help lower inflammation, so they will help lower that hsCRP biomarker. They can also increase your HDL cholesterol, which is really nice for your cholesterol. HDL is the happy one, so we want to have lots of happy cholesterol. And again, omega-3 can increase HDL. The other thing that omega-3 does is it lowers triglycerides. And so if you have high triglycerides on your lipid panel or your cholesterol panel, taking omega-3s can actually bring that down. So omega-3s do awesome things to particular biomarkers. And then ferritin, what is this? This is a transport protein. If it's low, it oftentimes indicates that there's iron deficiency. And so people that have levels less than 41 need to be on supplemental iron. And this can actually help them feel better and give them more energy and so on. And of course, magnesium and zinc are also very important. Zinc for fighting off infections and keeping our immune system healthy and keeping our conversion from the inactive to active thyroid hormone going. And then magnesium has many benefits, including relaxing our smooth muscle cells. That actually helps us breathe easier, and it improves our blood pressure, and relaxes our muscles and helps us sleep better. And a significant amount of people are actually deficient in magnesium. So we put here some very natural sources for vitamin B12 and vitamin D and omega-3 and iron and so on that you can sort of read about there. But the idea here is that they're very key biomarkers will tell us exactly what we need to be supplementing with, or the areas of our diet that we need to focus on to make sure we're getting adequate intake of these key nutrient markers. My fourth pillar of health is called hormones. Again, hormones are super important to think about because hormones are what actually make us feel good. And what I like to look at is your adrenal gland, which is measured by cortisol. I also look at testosterone. This is important not only for men, but also for women. Estrogen, mainly important for women, but estrogen can also go high in men, and men don't tolerate that very well without retaining water and feeling irritable. And of course, progesterone, that's a female-only hormone. Sex hormone binding globulin is really the protein that binds to our sex hormones, and we find that that number is really high. It can be a really good sign. Most of my healthiest people have really high levels of sex hormone binding globulin. So again, there are some very significant lifestyle changes that can come into play if we have abnormalities in our biomarkers. For example, if we have trouble with our adrenal gland, sleep is super important. So we need to make sure that we're actually getting tons and tons of sleep. We need to at least sleep 7.5 hours a night. Most people are not sleeping anywhere near that amount. And we also need to make sure that we are sleeping well, that we're getting into the deep stage of sleep. We can use things like adaptogenic herbs like ginseng and ashwagandha, rhodiola, and some of those things. We can take increased protein in the morning and take some carbs at night if we're having trouble with our cortisol measurements. So again, we can actually see if we're actually having trouble with our adrenal gland by measuring the test. We can measure the test either in the blood with a first thing in the morning cortisol. That's a screening test I like. I like to see cortisol nice and high in the morning. It's the get up and go hormone. Should be nice and high in the morning, and then throughout the day it just kind of slows down and reduces to a really low level in the evening and as you sleep. The other things that we can look at in terms of testosterone are, we have to understand the way we measure testosterone. So the best test for testosterone is not a total testosterone. It's actually a bioavailable testosterone. We actually have to look and see what's available for your body. By increasing exercise, particularly weightlifting, men can increase their testosterone levels. If they're overweight, just reducing that belly fat can actually improve the testosterone levels. And the reason for this is that the belly fat produces a hormone called 5' aromatase. This hormone is a little cranky. It takes testosterone and converts it into estrogen. So men, as they get more and more fat around their waist, they actually become more and more feminized because their estrogen levels go high. So again, some very, very natural things to think about as we're trying to improve these hormone biomarkers. So here's an example of a thyroid. Now, thyroid is hormone, right? This is what it looks like in the neck, kind of like an H, or you might imagine that's sort of a butterfly. And this is somebody who was thought to have thyroid disease. A couple doctors at the Mayo Clinic felt by looking at this photo that Lisa, the Mona Lisa, had hypothyroidism because she had some of the findings of it. So what are the findings of hypothyroidism? So if you're missing the lateral third of your eyebrow, if you have thin hair, if it's coarse, that can be a sign. The front part of her neck maybe looks a little bit full, like she has a goiter. Her hands appear to be somewhat edematous. She seems to have maybe a little bit of a weak smile. These, again, are all findings of hypothyroidism. Now, back then, hypothyroidism was mainly due to iodine deficiency. They just didn't have the iodine in their soil. Nowadays, we supplement all the time with iodine, and here in the United States, the most common cause is autoimmune thyroid disease, and it's particularly hard on women. women are about 10 times more likely to suffer from thyroid disease that's an autoimmune than men. And so if you're a woman, you have to be somewhat paranoid that you're going to go on to develop thyroid disease. There's so many women out there that have it. About 29 million women here in the United States suffer from autoimmune thyroid disease. So here is someone whose doctor had just run a TSH on him. Most doctors will only look at a TSH. It's the releasing hormone coming from the brain, and it signals the thyroid to produce T4, which is an inactive thyroid, and T3, which is the active. Now, my optimal levels for TSH are 0.4 to 2.0, so that TSH is a bit high for me, so I'm kind of clued to thinking something's wrong with the thyroid. My T4 optimal is 1.0 or above, and T3, I like to see it higher than 3.0. And so I'm thinking, well, the brain is signaling the thyroid with this increased signal, which indicates that the brain thinks that the body needs more thyroid medicine. And if I actually measure the actual thyroid hormone itself, it seems to be a little bit low. Now, this person had done some reading online and knew that they should probably check some antibodies, and they did. They checked some antibodies, and the antibodies were strongly positive. And so this indicates the person had an autoimmune thyroid disease. And so this woman, who's very disappointed that her primary doctor would not address the symptoms that she had, which she thought were relative to thyroid, with further testing. The only test that he ordered was a TSH, and it was, close to normal, so he told her not to worry about it. Well, she needed to actually get some treatment for this so she could feel better. And by the way, about 20% of autoimmune thyroid disease will reverse. And so there's very specific things that integrative doctors like to do to reduce the inflammation that's going on in her thyroid. Now, my fifth pillar of health is called healthy blood vessels. And so this refers mainly to cholesterol. Now, as an ER doctor, I can just tell you, 50% of the people who have heart attacks and come into the ER, their cholesterol numbers don't look that bad, at least on a normal cholesterol fasting lipid panel, which is what most doctors get. So we've thought for a long time there must be something more. Maybe there are other biomarkers that we need to look into. Maybe we need to do a deeper dive into the cholesterol to understand what's causing this increased risk. And about 15, 20 years ago, they came up with this technology that allows us to take a very deep dive into our cholesterol. So now it's just not about good and bad cholesterol. It's actually about the particles. In other words, the babies or subclasses of both good and bad. And from this, we've learned a lot. We've learned that about 1 in 5 people here in the United States have this genetic condition called lipoprotein A, which makes them much more likely to develop a blood clot, either a DVT or pulmonary embolus, or an earlier stroke or heart attack, because this molecule, genetically modified, is super small and super dense and gets inside the lining of the arteries easy. Relative to cancer and birth control pills and surgery, it's super important to know what your lipoprotein A status is, because all those other conditions put you at risk for developing a blood clot. And so many people die from a pulmonary embolism. And so it's just good to know, hey, I'm at higher risk of having a blood clot because of this genetic test. Well, it turns out this genetic test is included in something called an advanced cholesterol panel. So again, your doctor just checks a fasting lipid panel, not an advanced lipid panel. So when this panel is checked, they find lots of information. Not only are they looking at your good and bad cholesterol, but they're looking at the lipoprotein A, they're looking at the particle numbers, and so on. And so it's really key to monitor these biomarkers, and we can do it with something called an advanced lipid panel. Not very expensive, and I recommend at least everyone do an advanced lipid panel once in their life so they know what their lipoprotein A status is. About 99.9% of people here in the United States just don't know. And the reason for this is because insurance companies refuse to pay for this testing. They feel like it's investigational. All right, so there are some very significant lifestyle changes that we can do to improve the health of our blood vessels. We can exercise to raise our good cholesterol. We can eat foods that are high in omega-3s. We can reduce alcohol or eliminate it completely. And of course, we can reduce or eliminate refined carbohydrates and excess sugar. And of course, there's other things that we can do, very natural. I can put people on red yeast rice. It's just an over-the-counter supplement that will lower some of their bad cholesterol numbers by about 20%. Fish oil, again, the omega-3s, however we choose to take those can increase our good cholesterol. Those can reduce our triglycerides. Those can change the type of cholesterol that we have, and they can also slightly lower lipoprotein A levels. Niacin is a natural B vitamin, and it has been shown to dramatically lower lipoprotein A. In fact, it lowers it better than anything else that we have. So again, it's nice to know that there's some very natural things that can actually improve our cholesterol numbers. So this is what a standard lipid panel looks like. And again, about 50% of the people who come see me in the emergency room will have a fairly decent looking standard lipid panel. So this fellow's name is Bob Harper. He's a trainer with NBC's Biggest Loser, and he had a heart attack at age 51. He certainly doesn't look like he should have a heart attack. And so really, what was the cause of this? Well, he went on to Dr. Oz, and he revealed that the cause was lipoprotein A. And again, lipoprotein A is nothing that we really check ahead of time. It's only until after you have that first stroke or heart attack till the cardiologist says, well, maybe we should check this since you had this so early. Well, okay, so how about this? Why don't we check it 2 or 3 decades before you would have the event at all, so that we could really help you during that time reverse all of your other risk and try to bring down your lipoprotein A level if possible. And women need to know that if your lipoprotein A level is high, it will go even higher after menopause when you lose that protective effect of estrogen. So this is another thing from the Journal of Cardiology, very recent study that was done. Cardiologists are really now beginning to appreciate the significance of lipoprotein A and its association with heart disease, among strokes and heart attacks. Among strokes and blood clots. About 1.43 billion people have lipoprotein A in the world. And here in the United States, again, 1.2 million heart attacks each year in the United States. About 120,000 of them are thought to be due to lipoprotein A alone. So it's a significant risk factor for having a heart attack. It's also, again, a significant risk factor for someone who might have a DVT or a blood clot. So if you have cancer or cancer history, if you're taking birth control pills, if you're a smoker, if you've had recent surgery, these are all very high risk factors for developing a blood clot. So it's just good for your doctor to know your lipoprotein A status. You go to him and you say, hey, I have this lipoprotein A, which makes it much more likely for me to form blood clots, and I just thought I would let you know that before you perform surgery on me and so on, or before you put me on this birth control pill. Or, you know what, maybe I should consider this before I pick up the habit of smoking. Or maybe I just found this out and I really need to stop smoking because I just found this out. Again, it's all about sort of taking this new information and putting it into an overall plan for your health. Here in the United States, 1 in 5 people have lipoprotein A. I started looking, I became paranoid about this. I found it in my wife, I found it in her father, I found it in one of the healthiest nurses in our office, I found it in her mom, and she had a heart attack at the age of 47 and had a stent placed in her left anterior descending artery, which is called the Widowmaker artery. And it just so turns out that my nurse, upon some further study that we had to do with her, we found a lesion or a plaque development in the exact same place as where her mother had hers, and my nurse is in her mid-40s. And so again, this is all about trying to identify people that are at higher risk that we can follow a lot closer. If you do have lipoprotein A, there's a 50% chance that your children will get it. So it is something that you have to know about because it is genetic, and you will pass it on. You have a fairly strong chance of passing it on to your children. Now, if you notice in Asia, for years we've been wondering, what are they doing there differently, less stroke, less heart attack? Well, it turns out that if we look at lipoprotein A alone, they have half as much lipoprotein A. Conversely, when we look at people of African descent, they've traditionally had higher rates of earlier stroke and heart attack. Well, why is that? Well, they have the highest rates of lipoprotein A. So again, lipoprotein A is becoming recently appreciated as being a significant risk factor for stroke, heart attack, and blood clots. And it wasn't until recently that we've come to know about this. And what do insurance companies think about this? They don't want to pay for the testing. So very disappointing. So this really brings us to the obstacles, that we all run into. And the first obstacle, as far as I'm concerned, being a doctor, is health insurance. Because health insurance really can dictate our care. It can decide who we go see and how much they're going to pay and what types of tests they're going to cover. So unfortunately, in a lot of this information I just presented to you, many of those tests aren't covered. So, for example, homocysteine is not covered by most insurances. Homocysteine is that biomarker that, remember, when it's high, there's a very strong association with cognitive decline and Alzheimer's. There's also an association with early stroke and heart attack. And the treatment for high homocysteine is natural treatment, okay? It's a non-pharmaceutical treatment. It's actually giving methylated B vitamins. So wouldn't it be nice to be able to go measure homocysteine, again, not an expensive test, as a preventative measure for your health? Well, health insurance company doesn't think so. Same thing with other tests like the advanced lipid panel and lipoprotein(a) specifically. They don't think that any of that is necessary. In fact, I've got into a little bit of argument with them, and they've said, you know what, Dr. Hopkins, you should just put the person on a statin. Well, statins aren't for everyone. And for that matter, statins can actually increase lipoprotein(a) levels. They don't lower them. And so if I'm going to put somebody on a statin, I want more information, not less. So again, health insurance can be quite a big obstacle for most people. The other issue with health insurance, of course, is cost. Prior to 2013, I was dealing with people who had deductibles in the $500 to $1,000 range. So they were responsible for paying everything up until that point, and then the insurance would start to kick in and pay a percentage. Nowadays, about 70% of my patients will have significantly higher deductibles in the range of $5,000 and above. And so truly, more of the cost now is being borne by us as consumers. And health insurance hasn't gotten any cheaper. So again, a big-time obstacle. In fact, here is an email that I just recently got, and this is from Aetna. So Aetna recently implemented a new coverage policy for vitamin D testing. So this is an email that was sent to me, right? This policy is similar to others, and it limits coverage to only certain tests deemed medically necessary. Guess what? Aetna now considers vitamin D investigational. Okay, so this means they are no longer going to pay for vitamin D testing. So if somebody goes, the doctor thinks it's important, and they write, hey, go get your vitamin D testing done. You go to the lab, you test for it. You're going to get a big bill from the lab company right now, saying that, I'm sorry, your insurance has denied the payment for vitamin D. I mean, vitamin D, of all things, they're now not willing to pay for. So again, so many great things about vitamin D, and I really do think there's a lot of strong data along cancer prevention with vitamin D and improvement of insulin sensitivity. And so I just really, among many other things. And so I really am astounded, but not surprised by what the health insurance companies do. And here's the issue as relating to cost. And so when a person has a very high deductible, they oftentimes will get these bills. This is an actual explanation of benefit bill that was brought into me by one of my patients who said, is there anything that you can do? These tests are so expensive. My deductible's $10,000, and you only ordered like 9 tests here, and the bill's over $1,000. And from this, and I'm just showing you this because this was the genesis or the beginning of me wanting to be able to go directly to the public and offer them discounted testing. So in my mind, what if I could go and if I could bring thousands and thousands of people to lab companies as a group and say, we want discounted pricing, and I'm going to get discounted pricing from you because I'm literally bringing thousands of people to you for the pricing. And so this is why there's been a fairly explosive growth in the ability now to go online and order your own blood tests because these costs have gone out of control. And people that used to have good coverage now don't have so much good coverage. And as an example, had they gone to my direct-to-consumer website, yourlabwork.com, they would have paid a total of $337 for these tests, not over $1,000 for the tests. So again, the idea here was to save money. And so this is why I started Direct Access, is because more and more people just needed some financial help. And man, I was able to do that because of my experience with consulting with some of these lab companies, and I knew how they worked. Here's another interesting thing you should be aware of before you get a bill. Prior to 2013, when they had better deductibles, they also had something called better co-insurance for labs, meaning after you meet their deductible, that doesn't mean that they're going to pay 100% of your labs. Prior to 2013, they would generally pay about 80% of your labs. So lab companies were happy with that. You know, they were getting 80% from the insurance company. They had gotten, you know, all your deductible and then 80% of the rest of it from the insurance company. So by law, they had to send you 3 bills in the mail over a few months. And if you didn't pay it, they would just write it off. Well, now, after 2013, 2014, and these very high deductibles, we've seen lab co-insurance go from 80% for most people down to 50% for most people. So now what's happening is after you hit your deductible, they're going after you for that additional 50%. The lab companies before would just be willing to send you out bills and write it off. But now they're being hurt so much by the reimbursement, not getting that money from the insurance company, that now they're turning people into collections. And so I've seen this as well. So again, this is another reason why direct access lab companies are now, you're seeing more and more of them. The other issue that we have as an obstacle, I think sometimes, is the medical industrial complex. And so really, what is this? Well, this is going to a doctor and you're expressing your concerns. You know, you're reading online, you've read some pretty cool stuff, and you feel like you want to ask them a question. Maybe you want a specific test done. Maybe you read about TSH and you knew that it wasn't, you know, sort of the best test for thyroid function, and you really wanted the whole banana to look at the thyroid. And the doctor would say, well, you know, I'm sorry, that's not necessary. Or maybe you read about a test and you read about the importance of it, but because it wasn't ever covered by insurance, the doctor doesn't know much about it. And so he would kind of poo-poo it and say, well, you know, you don't really need that. And so I think that, you know, a lot of people are running into this now for 2 reasons. Number one, everybody's reading more. There's a lot of information out there that people can easily access. The other thing that's happening is doctors are being really constricted in their time, and so they're not able to spend a lot of time with their patients. And so within that few minutes, you know, they're just trying to, you know, treat a disease process and move on down the road. So it is kind of disappointing. And I write this, I mean, I say these things as an integrative doctor, meaning that I do allopathic medicine, but also I do some functional or anti-aging type medicine. The reason why we're having trouble is because people are starting to think like this. This is an article from the New England Journal of Medicine, and this is talking about how we really are out there preaching now that people should only come when they're sick. We shouldn't be doing preventive medicine. This whole article is about what a waste it is to do preventive health visits with our doctor. And if you're me, you know, like, remember the time when, you know, I would go and spend this time with my doctor, you know, it was the time I actually formed a relationship, and it seemed like it was kind of long, 45 minutes. They do a complete history. We'd do preventative labs. We'd review everything, make sure everything's good, answer all my questions, educate me. It was really kind of a time for education, you know. And so now these guys are recommending we do away with it because it's just eating up too much of our time, and these preventative tests aren't worth it. So again, this is what's going on in the backdrop of allopathic medicine. It's being run by the insurance companies that are making doctors see more and more patients, spend less and less time for them, and they're dictating what they will allow those doctors to do with reimbursement. So the question is, then what are we to do? I mean, we're out there as consumers, and, you know, I'm a concerned doctor. I've seen this going on now for years. What do we really do to actually change the way that we think about our health? And so this really became the mission of our company, was how can we take people out there that are really looking for solutions and resources, and how can we actually partner with lab companies that are willing to provide discounted labs for people, and integrative doctors that may be able to spend more time with a person And so you're not just sort of that 5-minute visit, right? And so how can we provide the resources that are reliable, education that is great? And so that person who wants to be empowered, who wants some control over their health, can now begin to see that they actually have it, that there is access to some really cool testing. There is access to preventative medicine. And so that's what we did here is we formed this company called Your Lab Work. And what it is, it allows people to go onto the site and to actually order labs without an in-person visit first. And this is key. I mean, there are doctors behind the scene that will actually order the tests and review the results for anything that is urgent that will require you to immediately go to the emergency room, and then we'll release the results to you to follow up with the physician of your choice. And then on the other end, there's people out there that have taken tests that have said, you know what, I see these tests, some of them are good, some I'm concerned about. I really want to talk to an integrative doctor or an integrative practitioner more about this. Is there any way that anybody that can do this? And so we've partnered with a company called Integrative Health. They're actually a physicians out of Arizona, doctors, MDs, that will do telemedicine throughout the country to review lab results with people that are concerned. And so it's kind of like a network of education is what it is. Being able to access the information, your own biological data, and then getting the right education so that you yourself can now be an active participant in your health. And I truly believe that you get better outcomes when you do this, when people are actually enrolled in their health. So this is how it works, just to give you guys some idea. You go and you can order lab tests online, and then you go and you visit a local draw station. And with our lab company, we actually have kits too that we send to people's houses to test for food allergies sometimes, or maybe there's some concern that glyphosate is in either their blood or in their water, and so you can urinate into a cup and we can screen it for glyphosate, the weed killer, and then also we can test the home water through that same mechanism. So in addition to blood tests, there's some pretty cool toxin measurements that can be done. And so if you do a blood test, then we generally will send you to a Quest Diagnostics lab that's nearby. And then from there, you'll get your blood work drawn. And then a report will be sent to you via email in a secure fashion when it's complete and reviewed by our doctors. The biggest thing, if you're going to go online, with our company, it's called yourlabwork.com, is that there's access for you. We want to make sure you go to the top of our homepage and click on this locate a draw station, because we really want to make sure there's a draw station nearby so you're able to participate in the blood draw. Now, if you're concerned about some of these other things, about food allergies or the urine testing where we're looking at glyphosate or other toxins or so on, those are all kits that can be mailed to your house. But if we're just talking about preventative labs for blood work, and I'm talking about advanced biomarkers for blood work, you really should be near a Quest draw station. That's who our blood draw partner is. And we partnered with them because they literally have thousands and thousands of locations. One of the cool things I want to point out about Your Lab Work is that if you want a custom panel, you can go and order a single test at a time from this custom panel page. And so maybe you've had some recent blood work done, but maybe nobody checked an A1C for you. And so you could go here, and all on this one page, you can order pretty much any test on our site in this one page. So to the left are the tests, and then to the right are the descriptions of the test, just to kind of remind you, what you're looking for. So I want to give you an example of this. And of course, I'm going to point out that to the left, there's an auto calculator. So if you're on a budget, say you would spend $100 on lab tests, you would keep under budget by using that calculator. So people really like this. My 5 pillars of health are all laid out on this page, by the way. At the top, we talk about hormones, then we go right into sugar metabolism, then we go into cholesterol, inflammation, and then nutrients. So again, the 5 pillars of health are all available on this one page. And this is kind of how it works. This person clicked on sugar metabolism, that tab. It drops down. Do you want a glucose? Do you want an insulin? Do you want an A1C? Well, if I didn't know what those were, I could click on the tab to the right and I could read about it. Why would I ever consider checking an insulin? I mean, why would I check an A1C? And so it gives you sort of a brief, like this is why you would check these things. And then, of course, if you bundle them together, you can save more money and so on. So we tried to make this really interactive for people and give them a chance to, to stay under budget and so on, and get access to a single test at a time if they so desired. And by the way, if anybody wants to participate in ordering their own test, write this down right now. It's a $20 off coupon code, webinar20. So, I mean, at the worst, you could go in and order a hemoglobin A1C test, which is your 3-month measurement of blood sugars. It's the screening test for prediabetes and diabetes, right? So if your A1C is above 6.5%, 6.5% or more, then that's consistent with diabetes. If it's from 5.7 to 6.4%, that's more pre-diabetes. So if you're out there and you're concerned about early stroke and early heart attack, just know that, pre-diabetic state puts you at risk for those things. And so you don't even want to be pre-diabetic, you want to be completely normal. But if you use the coupon, the webinar 20, you could literally order the test and it would cost you $5. And by the way, we cover the draw fees. So all the phlebotomist fees and all the shipping fees, if you're going to have kits shipped to your house, we cover. So don't ever worry about that. Some of the other things that we do is we like to look at popular panels. The Advanced Cholesterol Panel is available on our site. It does include lipoprotein A and all the lipid subclasses. It is the best cholesterol test that we have. It's $175, very reasonable. You could use your $20 coupon on that if you wanted to get that. Nutrients and omegas, that really just goes to the nutrition that I showed you, the key biomarkers in nutrition. We're going to look at your B vitamins and your vitamin D and your omega-3 index, make sure those are all optimal. Or maybe you want more like the whole enchilada, where you want to look at all of the biomarkers that I just showed you from all the 5 pillars of health, and you really wanted to just get a comprehensive look so that you could spend the next year fixing the issues that come up for you. In other words, trying to optimize the biomarkers that you need to optimize after giving yourself a big comprehensive look. And so that thing's called the Transformation Panel. It's available on our site. So some of the resources that we like to provide people, because this is key, and I got into this initially to save people money, and I found out that people really want education and they want resources. So we have built an education platform for people that want to participate. And so the first thing that we ask is, would you like an integrative doctor? Because we do have doctors that we partner with that do telemedicine. We have an OBGYN integrative doctor that deals with hormones, particularly female hormones. And so that person can talk to people throughout the nation. We also have integrative doctors that specialize in thyroid and cholesterol and so on. And so if you need an integrative doctor that you can talk to on your phone or on telemedicine, we partner with them. They're completely separate from us. So we basically give you a link to their site. You show them your blood work. That's something for you to share. We don't ever share anything with them. That's the other issue with direct access testing, is it doesn't ever go into a medical record. So if you want to sort of keep everything your business, it doesn't go into a medical record. This is all just private information between you and the lab company. It has nothing to do with your doctor or your insurance, because it operates completely outside the insurance market. It's a cash-based system, and that's how we get discounted pricing. We're completely outside the insurance game. We do partner with these integrative doctors, so if there are concerns on your labs and you really want to talk to somebody, we're gonna be able to give you a link so you can schedule with them. What I like to do with people is actually give them some downloadable videos that come across when they get their blood test done to prepare them for their visit, so they have a baseline understanding of their labs, so that they can ask intelligent questions and that their concerns are validated. So I do have some natural recommendations and optimal values, and Sean, I'm just going to kind of show you, and something that I call a special offer. And this is something that I started doing with my patients initially, because I really wanted to enroll people in the idea that they need to take a comprehensive look at their health at least one time a year if they're really serious about their health. Because, we spend so much money on these iPhones and laptops and memberships and subscriptions and all this kind of stuff, and we pay very little attention to our health until we don't have it anymore. And then all of a sudden we become interested. Well, I would love to keep people protected. And one of the ways that we do that is we do this thing called Transformation Panel, and then we provide people resources. So what I want to do is offer you guys that are listening today, if you want to, and remember I gave you that coupon for Webinar 20, so you could literally spend just $5 and be off this webinar and be fine. But I want to show you this because I think this is something really cool for yourself or maybe for a family member or a spouse or so on. This thing is called the Transformation Panel, and it includes over 60 blood tests, and it involves all the 5 key areas of health. So we're going to look at hormones. So we're not only going to measure the thyroid hormone, we're going to measure the antibodies and then the active thyroid hormone free T3. We want to look at the adrenal gland functioning by measuring cortisol. We want to look at the brain-releasing hormones by looking at the follicle-stimulating hormone and luteinizing hormone. And then we want to look at estrogen and progesterone and testosterone because they're super important. Metabolism, of course, we're going to measure insulin. Okay, not many doctors are measuring it. And again, trying to improve insulin early on is so much easier than trying to reverse diabetes. So wouldn't you rather know the first problem that shows up in blood work? Maybe you have diabetes out there and you're concerned about what your A1C is and your glucose and your insulin. The problem with diabetes is once you become a diabetic, really hard for you to make insulin sometimes because your pancreas poops out. So we're going to run these tests. Also, we're going to look at your liver and kidney function, your liver and protein stores, and a complete blood count, something that everybody should be doing at least once a year. For cholesterol, I'm not going to recommend just a basic lipid panel. I want people to be doing an advanced lipid panel. And this is where they're looking for lipoprotein A. We want to know what our lipoprotein A status is so that we can tell our providers that we have lipoprotein A. And again, these insurance companies don't want to measure an advanced cholesterol panel. I think it's absolutely essential to the decision making that needs to happen as we get older on how we lower cholesterol. When we're young, dietary intervention, there's key nutraceuticals that we can do. When we get older, everybody's going to want to put us on statins, and we have to be careful about that because there's some risk with statins. Inflammation. We're going to look at CRP, that high sensitivity CRP marker, and of course homocysteine, the marker that puts you at risk for having cognitive decline. And then we want to also measure this uric acid. Remember, uric acid not so good. High red meat, high uric acid. Body does not like inflammation. Bad things happen in an inflammatory environment. And then, of course, nutrients. We want to measure those very common nutrients that people are deficient in, like vitamin D, the omega-3s, serum ferritin, which measures your iron. It's an approximate for your iron. And then we want to look at those important B vitamins, remember, that are in the methylation pathway. We want to make sure those are good. And then magnesium and zinc and selenium, these, again, are very important for thyroid function, blood pressure control, those kind of things. So we'd like to look at all 5 of these key areas in the transformation panel. So that's what this is. So, okay, I'm just not telling you, let's just buy a transformation panel. That's not what I'm saying here at all. I'm not saying spend $1,750 on a transformation panel. I'm saying a transformation panel is what I'm going to offer along with something that I like to call a cheat sheet. These cheat sheets are based on every single biomarker that we have on our site. And of course, they're updated. So they're updated continuously. So it gives you, what I want to give you is free access to all the updates too that we do as we bring on new tests. And so on, I'm going to bring an example of this. So this is an inflammatory panel here. These are the tests that we run for inflammation. And so I'm going to tell you what the biomarker is, a brief description of the biomarker. I'm not going to tell you what the reference range is. I'm going to tell you what optimal is, okay? That's where we want you as an anti-aging doctor or an integrative medicine doctor. And then all the natural things that you can do to actually improve that one biomarker, or things that you need to be talking to your provider about in regards to this one biomarker abnormality. And so that when you go in and you have a discussion with your provider, that you know the very key things, it distills down the very key things as part of your treatment plan, the things that you want to be doing, and a lot of really cool information about stuff that you can be doing naturally to change these biomarkers. So just to go up close on the CRP, so this is the HS-CRP. It's a very sensitive marker for inflammation. It increases with unhealthy fat cells, which is obesity, chronic disease like diabetes, autoimmune disease, infections, pain. So we don't like for people to get their blood work done when they're feeling terrible. We like, unless feeling terrible is your baseline. Feeling terrible is your baseline, go get your blood work done. That's fine. Preventative medicine, we want to have you feeling pretty good when you go in. We don't want it done after recent surgery or recent illness because your CRP will be high because of this recent problem that you had. We want to know if you have chronic inflammation. So you need to be at baseline when you get your CRP measured. What is the optimal value? Of course, it's less than 1. What are some natural things you need to talk to your provider about? Well, omega-3 fish oil, that can reduce CRP by 25%. CoQ10 is good, particularly if a person's over the age of 50. What is it? It's something our body makes naturally, but after the age of 50, we don't make it as well, and inflammatory environments improve with CoQ10. If your number is between 2 and 10, that's usually due to some type of, metabolic disturbance. And that metabolic disturbance can oftentimes be reversed. So you might say, what's metabolic disturbance? What oftentimes is sugar problems. So as you fix sugar problems, inflammation can go down. Other things to consider, if it's above 10, we have to really consider the possibility of autoimmune diseases and cancer if it remains high for a long period of time. Weight loss can really help, particularly if you lose belly fat, what they call visceral fat. Exercise can decrease CRP. And of course, sleeping well decreases CRP. And then of course, getting rid of all those processed sugars. And if we can't find the cause of it, we're doing all these natural things and it's still not moving, then we really have to have our doctor investigate why our CRP remains high. Lipoprotein A, this is just another example, and there's numerous cheat sheets in there. We have about 8 different cheat sheets listing the various blood tests. So every test that you would get on the transformation panel, you'd get a cheat sheet for so that you could quickly look at it and then come up with ideas on what to go over with your provider on your treatment going forward. So let's look at this one, lipoprotein A. Remember, 20% of people have it in the US, so 1 in 5 people listening to this will have it. What is it? It's the worst type of LDL cholesterol. Well, what is LDL cholesterol? Low-density lipoprotein. It's genetically inherited, high risk of blood clotting, okay? The optimal value is actually less than 60. Less than 75 is normal. Less than 60 is optimal. What can be done? Well, we know omega-3s can lower it by 10%. Niacin, when it's the long-acting form, at high dose can lower it by 30%. Baby aspirin probably should be taken because it prevents blood clots. Remember, people are higher risk for blood clots with this. We need to bring down your bad cholesterol really low, and we need to understand that nutritions and statins do not lower lipoprotein A. So we have to be concerned about lipoprotein being high. Many people, I refer them to a cardiologist when they have high levels of lipoprotein A for a coronary calcium score. This is when they lie in a CAT scan and they actually measure the calcium around the arteries. If that number is super high, they're going to end up doing a stress test on them just to make sure they don't already have a flow-limiting lesion in their heart. And then, of course, we're going to recommend that all adult family members be tested. Why? You have a 50% chance of giving it to your offspring. And then, of course, a great resource for people is the lipoproteinafoundation.org. These people came up, they did pressured everybody to get an ICD-10 diagnostic code. So now people are actually talking about lipoprotein A. Again, insurance companies are not paying for it, but people are talking about it. And it's important that all of us know what our lipoprotein A status is. I do not have lipoprotein A. My wife has it. So when our children get into their adult years, we're going to check all of them. We're going to see who has lipoprotein A and who doesn't. And I'm just going to keep an eye on and counsel people that do have that lipoprotein A. The other thing that I thought would be really cool is if we offered a transformation panel. So we're offering this big blood panel and all these cheat sheets to try to make it easy to understand the right questions to ask your provider. Wouldn't it be great if you actually had access to a digital platform where I actually teach all about different markers? So maybe it was that one of your tests came back abnormal and you wanted an immediate deep dive of the latest in scientific information about that particular test. And so I'm allowing you guys to use this thing that I've sold to hundreds and hundreds of practitioners. And this is a deep dive into the various tests that are offered on our site. And so it really is an educational platform that we're going to include in this offer. So not only are we going to give the testing and the cheat sheets, but we're also going to give you access to this deep dive information if you want to. And it's continuous access. It's not a subscription or anything like that. And it's access to updates too. We update it in real time. So if I hear something new, or there's a new treatment for this, or we can change this particular biomarker in a positive way by doing this, I just quickly add it. If I want to change a photo, or maybe I found some information that I think you should know, I just upload it to the site so that you can log in and download it if you want. So again, this is just kind of an idea of what it looks like. Now, red meat increases purines, increases inflammation. So we talk about how when you measure uric acid, one of the key things that we need to make sure you're not doing is eating red meat because of the inflammation. Again, people that have inflammation, they're at higher risk. And so we believe that inflammation is the root cause of all chronic disease. So the transformation panel is $17.50. The Health Library, I offer this right now for $14.99 for people, and our optimal value cheat sheets are $249. So this is, $3,500, but we don't want it to have that for you today. We want it to be really reasonable. And so we're going to give you this for $14.99, which includes the $1,750 lab panel. That includes the lab draw fees, all those tests in the panel, and in all the cheat sheets. In addition, because you're on the webinar here today, we're going to give you a coupon code that you can put on here to take an additional $100 off, called YLW100, stands for Your Lab Work. So if you put that in at checkout, you'll save another $100. So if you are due for a comprehensive blood draw, or maybe you haven't had some of these key important tests and you really want access to some of the cutting edge information about these tests, so that you're going to become a more intelligent person in regards to your health, and you're going to be able to ask better questions, this is the opportunity to do so. I do believe you'll have better outcomes when you're a better educated person in regards to your health. And so I'm really excited that you're able to look at this. Now, we do have some payment plans for people that really want to take advantage of the education piece of this. When the payments are actually done in full, then we'll release the lab requisitions so that you can go and get the lab testing done. Again, this offer, just so we're clear, includes all the labs. It includes the which are in the transformation panel. It'll include the cheat sheets and the deep dive training modules if you want to access those. You'll just have a membership with continual access to it if you want to do that. Now, if you are unsure, you want to talk to a real person, give us a call at 1-855-FAST-LAB. We only have one line, so if it's busy or rings to a voicemail, don't worry. It actually goes to email. So just leave your message and how we can get a hold of you, and then we'll call you back. Sometimes you like to talk to real people. If you're more of a chat box person, you can hit up our chat box at yourlabwork.com. We'd love to talk with you there. If you want to email support@yourlabwork because you want more questions, then certainly go there. And this is the link where you can find out more information at yourlabwork.com, Dr. Allen Masterclass. And this is where you'll see all the information about the Masterclass. So this really is an opportunity for people that are really into their health, and they want a very global picture of where they're at, a comprehensive picture, and then most importantly, they want the education piece. And so if that's you, then I hope you're able to take advantage of this. If it's not, but you still find value in ordering your own blood work, then use that Webinar 20 coupon to save off of a single test and just try it out. Again, we're trying to get people to be empowered to take control of their own health. If you have a high deductible, and so on, you're the person that might be looking at this because the cost for these labs can be quite out of hand. The other issue I wanted to mention, if you do have a flexible savings account or a health savings account, you can get a receipt to submit to those from this. Since the blood work costs more than what this cost is, you can write off the full amount. So although you're buying education with blood work, the blood work costs more than education plus blood work, so you're going to be able to write off the full amount for your HSA or FSA. Now, some questions are coming up. Why? So why doesn't my health insurance cover it? Well, your health insurance requires that you go to your doctor first, and they have to give you something called ICD-10 diagnostic codes, and those diagnostic codes are how they decide whether or not they're going to pay for the lab. So if your doctor puts sort of vitamin D testing on there or whatever, now Aetna is going to deny that. But the idea is that they'll associate that diagnostic code from your doctor and decide whether or not to cover the payment for your lab. And so if we go within the insurance market, we're kind of stuck with whatever the insurance says that they will allow. So again, this is completely outside the insurance market. People get what they want, and oftentimes they get it at a significantly better price. So again, everybody's situation is different, but I really appreciate you guys taking the time to sit in on this webinar today, and I'll be around to ask a few questions on the online chat. All right, guys. Well, for those of you that need to run, I really appreciate it, and thanks for your time.